Currently getting it set up on YouTube. Thank you guys for coming in and getting situated. You guys have been great this morning.
I see that our Executive Director, Gary Hutman, has joined us. Gary, if you'd like to be promoted to a panelist, will you please raise your hand? Okay.
Diane needs the link sent to her. Arnold?
I'm sorry, what did you say?
Diane Arnold needs the link sent to her.
Okay, well, let's
hear that, Leilani.
Okay,
Okay.
thank you. Okay, Mr. Chairman, we are now recording and the meeting is streaming live on YouTube. So you can go ahead and begin whenever you're ready.
Thank you so much. This meeting will now be called to order. Welcome to this virtual Transportation Disadvantaged Local Coordinating Board meeting for May the 14th. I'd like to call the meeting to order at this time. I am Jose Alvarez, the mayor of the city of Kissimmee, and I'll be sharing the meeting today. We also have a team of folks that are working to ensure this meeting runs smoothly. We're operating under emergency orders from the federal, state, and local government to conduct public meetings in a responsible manner due to COVID-19 pandemic. Today's meeting was advertised on the MetroPlan Orlando's website and social media, as well as through targeted emails and as Orlando Sentinel ad. The virtual meeting is accessible to the public by computer, tablet, or phone. As mentioned, the meeting has also been streamed live on MetroPlan's Orlando YouTube channel. Florida Sunshine's law typically requires a quorum to be physically present in a room for a government meeting. However, Governor DeSantis suspended this requirement in an executive order allowing government boards to conduct business using virtual meetings. Now it's time for the Pledge of Allegiance, and today I'll ask Dr. Linda Silverman to lead us in the pledge. Everyone else, please remain on mute.
Okay, thank you. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, liberty and justice for all.
Thank you so much, Dr. Silverman.
Welcome.
Next, we have a short video to review our virtual meeting guidelines. This will help our meeting flow smoothly.
Welcome to MetroPlan Orlando's virtual meeting. Here are some things you should know. Board and committee members are active participants, and members of the public are observers. Our chairperson will make sure to keep the meeting flowing. Please keep your microphone or phone line muted unless recognized to speak. Make sure to pay attention to your video controls as well. Participants are welcome to use the raise hand feature to ask questions after presentations. This feature can be found when clicking on the participant's icon. When recognized by the chair to speak, you can unmute yourself. Please make sure to speak clearly so everyone can hear you. You may also submit questions via the chat box by clicking on the chat icon. A moderator will relay your question. Thank you.
Thank you so much. So we'll keep our microphones muted unless you've been recognized to speak. And we'll use the raise hands feature to participate in this discussion. There are 2 public comment points in the meeting. Members of the public who want to speak will use the raise hands feature found in the participants tab. If attending by phone, you can hit *9 to raise your hand and request to be recognized. When you're called, your microphone will be temporarily unmuted by staff and will ask you to state your name and contact information for the record. I see someone, Pat Bates, her audio is breaking up. And yeah, she's on mute. Thank you, Mayor. We also accepted comments by email and phone messages before the meeting. Guidelines for public comments are posted at metroplan.orlando.org/virtual meetings. Public comments received before the meeting will be read by staff at the conclusion of the meeting. We want this and all future online meetings to be accessible to all. Participants may join by computer, tablets, or phone. If you need accommodations to participate in the future, please contact MetroPlan Orlando. At this time, I'd like to recognize Virginia Whittington for some announcements. Virginia?
Thank you, Mr. Chairman, and good morning, LCB members. Thank you for working with us during this transition to virtual meetings. We remain dedicated to having good discussions about transportation planning in Central Florida, and we're doing our best in this environment to stay transparent and accessible to the public. We really appreciate your patience and your understanding. We will be sending out a survey after this meeting so that you can tell us about your virtual meeting experience and let us know how we can make these meetings better in the future. As the chair mentioned, we'll be using the raised hand feature to recognize committee members during the meeting and to call on members of the public during the public comment period. If you've joined us today on the phone without the video screen, please use *6 to mute and unmute your line. Please use *9 to raise your virtual hand so that a meeting host can see that you wish to be recognized. You will see that there's a chat feature on your toolbar. This communicates with all panelists in this meeting, which includes LCB members, staff, and presenters. Please only use this if you're having technical difficulties or if you need assistance. A full record of the chat comments will be included with the public record of this meeting. Now, Mr. Chairman, if it is okay, I will move forward with a roll call so that we can confirm that we have a quorum for the meeting.
Yes, please do.
All members, please go ahead and unmute yourselves in preparation for the roll call, and you can mute yourselves again after your name is called. Also, if possible, make sure that your video is shown so that we can confirm it's you. You'll find the unmute and video buttons at the bottom left of your screen on the toolbar. Please say here or present when your name is called. I will first start with the elected officials in alphabetical order and then the remaining of the members. Mayor Jose Alvarez.
Present.
Mayor Pat Bates.
Here.
Commissioner Myra Uribe.
Present.
Ms. Diane Arnold. Ms. Marilyn Baldwin.
Present.
Mr. Chad Ballard. I saw that he was on. Ms. Nika Berry.
Good morning, present.
Ms. Crystal Ford.
Present.
Mr. James Greshik. Mr. Norm Hickling, non-voting.
Present.
Ms. Sharon Jennings.
Present.
Dr. Linda Levin Silverman.
Present.
Mr. Bob Melia. Ms. Janae Olds.
Present.
Mr. Wayne Olson.
I'm here.
Ms. Carla Radka.
Present.
Mr. Wilfredo Rices.
Present.
Ms. Jo Santiago,
I think you mean Joe Santiago.
Ms. Jo Santiago,
I'm present.
Mr. Calvin Smith,
Present.
Ms. Alnita Witt,
Present.
and Mr. Adam Zabritsky.
Present.
Mr. Chairman, we have confirmed that we do have a quorum, and we also have all of our presenters present.
Well, thank you so much, Ms. Whittington, for all the hard work that you guys are doing. And I know that everything behind the scenes is you guys, so thank you for the work. Now we'll move on to public comments on action items. We'll now hear public comments on action items. Do we have do we have people who want to speak to any of the action items? If so, please use the raise hand function found at the bottom of your screen or by pressing *9 on your phone number. When you call on, the host will unmute your phone microphone. You will see a button pop up that says the host wants you to unmute you. Accept that prompt to activate your microphone. We ask that you provide your name and address for the record. As with our in-person meetings, we ask that you please hold your comments to 2 minutes or less. Are there any comments at this time?
Mr. Chairman, I do not see that there are any raised hands.
Thank you so much. Are any written or phone comments that were submitted before the meeting pertaining to action items?
Mr. Chairman, we did not receive any written comments, nor did we receive any by phone.
Thank you so much. We'll move on to item 7, committee reports. We'll move on to Quality Assurance Task Force report by Ms. Marilyn Baldwin. Ms. Baldwin, you're recognized. Ms. Baldwin?
Can we have someone to unmute Marilyn's? There we go. Leilani, are you able to unmute Marilyn's phone?
Yeah.
Can you hear me?
Yes,
there you
go
are.
ahead. I went ahead and unmuted you, Marilyn. You can start.
Okay,
Sorry about that.
I'm sorry. All right. The Quality Assurance Task Force met on April 28th, 2020. We reviewed and provided recommendations on the minor updates to the TDSP. Following a focused discussion about the eligibility criteria and application process, we made some recommendations that will be presented by Mrs. Whittington later on the agenda, and we're hopeful to receive the approval of the local coordinating board. We recommended approval of Access Links' fiscal year 2020 and 2021 TD rates. We received updates on the CTC evaluation and an update from the Links Mobility Services. Our next meeting is scheduled for July 28th. Mr. Chairman, this concludes my report, and I do want to take time to thank staff for guiding us through our Quality Assurance Task Force meeting and for the accommodations that they have provided, which allow me to participate in our meeting. Thank you, Mr. Chairman.
Thank you so much, Ms. Baldwin, and I want to thank you for your commitment to continue to work in that committee and the great work that you continue to do. We'll move on to to item 8 of the agenda, which is an action item. Now we all move to our action item. After each action item, I'll ask for a motion in a second. Please state your name for the record when making a motion or second it. Then you'll have discussion. When we are ready to vote, we will ask you to unmute your mics. Ms. Whittington?
Mr. Chairman, if I may, for the record, note that Mr. Chad Ballard and Ms. Diane Arnold are both present this morning.
Thank you.
And the first action item, Mr. Chairman, is approval of the minutes.
All right, so we need a motion on the approval of the minutes, and this will be done by a roll call.
It's in Roxanne's box right now.
If one of the
Okay, I
mem-
will make a motion, Pat Bates.
I'll second it, Dr. Linda Silverman.
So we have a motion by Mayor Pat Bates, second by Dr. Silverman. Now we'll do a roll call on the motion.
And if all members would unmute your microphones in preparation for the roll call, and after your name is called, if you will mute your mics again. Mayor Alvarez.
Aye.
Ms. Arnold.
Aye.
Ms. Baldwin.
Aye.
Mr. Ballard. Mayor Bates.
Aye.
Ms. Berry.
Aye.
Ms. Ford.
Aye.
Ms. Jennings.
Aye.
Ms. Silverman.
Aye.
Ms. Olds.
Aye.
Mr. Olson.
Aye.
Ms. Rodka.
Aye.
Mr. Races.
Aye.
Ms. Santiago.
Aye.
Mr. Smith.
Aye.
Commissioner Uribe.
Aye.
Ms. Witt.
Aye.
And Mr. Zabritsky.
Aye.
Motion passes unanimously, Mr. Chairman.
Thank you so much, Ms. Whittington. And we're doing roll calls, so it'd be easier because since we're doing this online, I wanted to make sure that for the purpose of the public, so they can see exactly who voted for each item. So thank you so much for bearing with me. We're moving on to item 8 of the agenda, item 8B, which is the approval of the Transportation Disadvantaged Service Plan, minor update. This presentation will be made in 3 parts. First, Ms. Trish Whittington will present the recommended minor updates. Following her presentation, Mr. Norm Hickling will present some proposed eligibility criteria revision discussion. After his presentation, Ms. Whittington will present the QATF's recommendation on the items. We will pause between each presentation for questions or comments, and at the conclusion of our discussion, we will need to take the 2 actions. Ms. Whittington from Links. It's the first presenter. And I would like to ask to please hold all your questions on these action items until the presentation is finished. Go ahead, Ms. Whittington.
Good morning. I'm going to review the changes that were made to the Transportation Disadvantaged Service Plan. This document is completed by Links, the CTC, in coordination with MetroPlan, the local planning agency, approved by the TDLCB and submitted to the Commission for Transportation Disadvantaged for the final action. It's a requirement for funding under the TD program. There are 3 sections to this plan. The first is the development plan. And the development plan looks at the roles and responsibilities of the TD program, as well as background and baseline conditions, goals, objectives, strategies, and the implementation program. Some of it's a 5-year plan updated with a major update on the first year, within the interim years are minor updates. This update is a minor update. And some of the revisions that were made were to add a TDSP certification page to be signed by the chairperson after the plan has been reviewed and approved. The TDLCB roster was updated to reflect the most current membership. Figure 1 shows the CTD structure, and that figure was replaced. However, there were no changes made to the actual structure. That diagram had just been in this document for some time, so we replaced it with a new diagram. The Links org charts were replaced just to show any recent staffing changes, as well as the Links service area map was updated to show the most current Links services within the service area. As part of this plan, a review of other local planning documents is completed to ensure consistency with other plans that have been completed, including the Transit Development Plan, the MetroPlan Transportation Improvement Program. All of those were reviewed. The Human Services Transportation Plan, and it did show that we are consistent as far as TD related. The TDP includes some expansion to TD services, as well as a upgraded fleet and travel training programs. The LCB certification was included. The most recent, I believe it was from March, was replaced in this document. The demographic summary was updated and compared to the last demographic summary completed. This one used 2018 American Community Survey data, and the results showed about a 3% increase in population and household over the last TDSP that was completed. Most of the demographic areas remain consistent, with a small increase in the age group from 25 to 35, as well as over 65, just a slight increase. We also look at population projections using the Bureau of Economic Business Research data from 2020 to 2045. It showed that Orange County population is expected to increase by 50%, Osceola County by 90%, and Seminole County by 30%. And these population projections are also consistent with the plan review that we completed and the land use trends in the area. We look at labor force and unemployment data. With the most current that was available was April 2018. So we did note in the plan that the unemployment rate was less than 5%. However, we did also note that given the current circumstances of COVID-19, we can expect that that has drastically increased over the last couple months, while 2018 data was the latest available. The major trip generators and attractors were pulled by the Mobility Services Department, so we could review where the most trips occurred in 2019, and those were dialysis trips, made up the largest percentage of TD trips. And the forecast of TD population and trips is a requirement of this document, and it was completed using a tool from the Commission for the Transportation Disadvantaged, and it uses ACS data and the Bureau of Economic Business Research data to look at how we can expect these trips to increase over a 10-year period. And consistent with other documents, they are projected to increase over up to 2028. It's from 2018 to 2028 is the timeframe we looked at. There is a needs assessment within this document. This was not updated this year. The Links Human Services Transportation Plan was just completed in 2019 and came before the TDLCB for review and approval in August of last year. So that's the most current, and that is incorporated into this document as attachment 6. And it includes a very comprehensive needs assessment using an extensive public outreach process, looking at the needs of older adults and individuals with disabilities. So that plan was reviewed while this plan was updated to ensure consistency and also incorporated. The goals, objectives, and strategies update. This section was thoroughly reviewed to make sure that what was included is actually what's being done or an attainable goal, something that mobility services can accomplish. So goal 1 was revised to include a measure relating to the new Access Links pilot program for travel training, which has been implemented, and it has been successful in providing passes to transition passengers from the paratransit vehicle to the fixed route vehicle with over 1,000 trips per month. So we added a measure to goal 1 to hopefully expand that program into the TD program for those who are able to use the fixed route service. Goal 2 of the previous goals was removed, but it was actually just combined. 2 and 3 in the previous program were similar. So we made one strong goal 2 relating to public outreach and education. So the previous goal 4 then became goal 3 of this document. And that one was revised based on the data that is available. As we went through and updated these goals and objectives and try to provide a status update on them, we realized some of the data relating to complaints is collected on an average. So this section was updated to look at a measure of the average time that it takes to resolve a complaint. And in this section, this goal, the call hold time had been previously included in there with a 10% goal of reduction each year. And in discussion, this was removed during this update. There are some things that Access Links is currently doing. There's a capital planning project in place to procure a new phone system that could help reduce call hold times by better routing the calls to the appropriate representatives. So at this time, that was removed from that goal with the intention that it would be reviewed later. So then goal 4 then became the previous goal 5, which is to standardize the mobility services procedures and document them. And then goal 6 became the new goal 5, which is to continue ongoing planning meetings between mobility services and the planning department. Goal 7 was removed, and that goal really related to creating a transportation provider inventory. And this is something that's done as part of the Human Services Transportation Plan. And there was a provider inventory created last year. It's included in that document, which is attachment 6 to this plan. And it will be updated each time that that program is updated. So that was removed at this time. And then status updates were also provided to kind of see where Access Links is at with achieving those goals. The implementation schedule was updated to correspond with the changes to the goals and objectives, and also include some action items, timelines, and responsible parties to achieve those. The second section of this plan is the service plan, and this section relates to the policy, the operating policies. Some corrections were made to table 9. We noticed that it was incorrectly reported, the TD policy relating to attendance. So it was corrected to show that companions may travel with a TD passenger at the same fare. However, attendants are not able to travel with a TD passenger. That's actually an ADA policy. So that was corrected within table 9. The trip prioritization was updated for 2019. And that showed that 71% of the trips are subscription trips, meaning that they occur on the same day or time each week. There was a section within here on the number of vehicles that were approved. There will be 74 new vehicles that have been approved for procurement and delivery within 2020. And the coordinated contract approval policy had previously stated that the manager of mobility services could approve those contracts, and that was revised to reflect that the director of mobility services will be approving those contracts in the future. Tables 10, 11, and 12 are updates to the providers under the program, as well as the vehicle inventories, and those were just updated to include the most recent data. The system safety program plan was updated for the most recent signature page for the provider for 2019. And there is a section within this document on acceptable alternatives. So while there are no acceptable alternatives currently to the TD program, we did add some language relating to the new travel training program because it has been successful, and perhaps it can help in the future transition some passengers to the fixed route system. The service standards are also included in this section. All of Links' service standards for Access Links are listed in table 13. So we went through each one of them to ensure that what is reported is actually what's being done. And we found 2 inconsistencies. So we updated the no-show definition. That was currently reporting that no-shows are looked at on a percentage basis, and that's not actually what was occurring. So that was replaced to show that Access Links sends out letters to the customers when they notice no-shows, just kind of letting them know of the importance of canceling that trip when they're not able to make the trip. And then if excessive no-shows continue, the service can be canceled, and the subscription service can be canceled and then revisited after 90 days if no infractions have taken place. And then there is also a call hold time standard that we reviewed, and it was currently at 3 minutes as the standard for call hold time. So we looked at average call hold time data, had some discussions, and revised that call hold time standard to 7 minutes. based on what we know about the current phone system and some of the initiatives that are taking place to update that system. There's also a new web access available so that customers can make reservations 24 hours a day, 7 days a week online and manage reservations. And hopefully that will reduce some of the calls into the call center and passengers having to wait for excessive periods. The cost revenue allocation rate structure is part of this document. However, this is a separate agenda item. So I'm going to skip over this, and Norm will be covering this section in just a few minutes. So the third and final section of the TDSP is the quality assurance section. And this looks at reviews and evaluations of the CTC. So the TDLCB completes an annual evaluation of the CTC, which is currently underway, as well as the Commissioner for the Transportation Disadvantage also audits the CTC, and that is also underway and currently being completed right now. So we added some language stating that those will wrap up and will be reported in the next update, as well as any findings and corrective actions that will need to take place. So to support this section, we looked at the 2020 Access Links passenger survey that was completed to find some data relating to quality assurance. And it was reported 72% of passengers felt that the service was excellent or good. And that is an increase over last year, with 62% had reported that. And we also found that 38% of passengers think that the service has improved over the last year. Call hold times were an issue that was noted in the survey, and definitely something that is being worked on within Mobility Services Department to try to achieve lower call hold times. The attachments within this document, attachment 2 and 5, were replaced to show the latest application and grievance procedures. And then, as I mentioned earlier, the Links 2019 Human Services Transportation Plan, which is attachment 6, was incorporated into this document. And I believe that concludes the revisions to this document. Thank you.
Thank you so much.
Thank you.
Are there any questions on this item? Please don't forget to use your raise your hand button before you go ahead, and also don't forget to unmute yourself. So if there's any questions of Ms. Whittington, go right ahead.
Mr. Chairman, I see a hand by Commissioner Uribe.
Go ahead, Commissioner.
Good morning, everyone. I had one question as a follow-up. Did we get the total amount of individuals that actually took the survey? Did I miss it?
No, but we can get that.
And Commissioner, the survey that Links conducted is different from the survey that you had at your last meeting. So just to make sure that it's clear that these are two separate surveys.
Well, I understand that. My idea is how many people took the survey, how many people were invited. So we actually have an accurate account for responsiveness is what I really want to know.
Okay.
Okay.
Any other questions?
I do not see any raised hands at this moment, but we'll give a moment just in case someone has a question. And we do not, Mr. Chairman.
Yeah, and I'm going to add the same thing. I like to see what's the percentage of the survey of the people that took this survey. So we'll love for that information to be provided to us. So now the next one is Mr. Norm Hickling, Director of Mobility Service with Links. He will present items for discussion regarding the current access link eligibility criteria. At the conclusion of his presentation, Ms. Whittington will share the QATF's recommendation. Again, I ask that you hold all your questions, comments until the end of the presentation. Mr. Hickling, you're recognized.
Thank you very much, Mr. Chairman.
Ms. Whittington, Mr. Hickling, hold on for 1 second. Ms. Whittington, thank you so much for your presentation. You did great.
Thank you.
Go ahead, Mr. Hickling.
Yeah, yes, you did. Thank you, Mr. Chairman and members of the board. This is a discussion that was that we wanted to start having with the Quality Assurance Task Force, and also this board. This is coming out of a desire here at Mobility Services to separate the applications that we've been asking clientele who are applying for the Access Links services. We would like to separate the ADA clientele from the transportation disadvantage. Obviously, there is different eligibility requirements. It would make it much easier for the customers in our community to understand, as well as it would make it easier for our eligibility team and mobility services reps if we had those applications separated. In doing that and looking at how do we go implement this process, we knew we needed to come back, and at this time with the revision and the update to the TDSP, this was the time to come and start having a dialogue with the Quality Assurance Task Force and this local coordinating board as to some of the eligibility requirements. And also, since we've started this conversation, it was very interesting that we just completed, and I'll talk about it later in the CTC report, but we just completed a review with the Commission for Transportation Disadvantage. And this is one of the items that they brought up that we need to go take a look at for the next coming couple of years. They suggested that we make sure that our eligibility process in-house matches, for TD, matches what's in the Transportation Disadvantage Service Plan. Right now, we don't. Our only eligibility that we do right now for TD is to see if somebody has access to a fixed route links system. If they don't, and they don't qualify for ADA, then they qualify for transportation disadvantage. And I think you see here from this chart, and I don't know, Virginia, are you gonna go through this or not, this part of it? But what we would like to do is have feedback, and we've already had suggestions come back to us from the Quality Assurance Task Force as to what eligibility requirements and criteria will we use going forward, and that we're all in agreement that this is the criteria to grant somebody eligibility access through the TD program. So Virginia, do I leave it to you at this point?
You can go ahead and make your presentation as you did to the Quality Assurance Task Force, and then I will come back one by one and report their recommendation.
Very good. So right now is, as you see, as I talked about, separate the application process for each program, ADA from TD. And we want to update the TDSP to include what we all agree upon is the criteria for granting that eligibility. Now we know one of the eligibility requirements is that TD is supposed to be the it's not a sponsored program, and we are of the last resort. If somebody has Medicaid rides available to them or has another way of having travel, that we wanted to use that as a criteria. It's currently in the transportation service plan, but we want to get approval to ask our customers when they are asking for this eligibility if they have availability like non-emergency medical transport through their insurance programs, through Medicaid, etc. Again, if they do, then we want them to use those. But if they don't, then we would use it as we would use that as part of the application process. And also we want to be able to, or we want to have that discussion, should we, right now we do not ask if you have a disability to be part of the transportation disadvantage program. That is a criteria that is allowed on the TD program from a state level. It's currently listed in the TDSP. However, we have not been using that as a criteria to put people onto the TD program. So we want to be able to, again, get your input, have your advice back to us, and then we can move forward. I think I covered. We also don't have a way, and it's another eligibility criteria, is to look at what your poverty level or what your ability to pay for transportation services are. There is a criteria with the commission right now that establishes that anybody that's less than 150% of the federally established poverty level, then they are considered disadvantaged. And that would be used as a eligibility criteria. Currently, Mobility Services Access Links does not use that because we have not established a way to go perform a income-based assessment. Now, there are ways that have been outlined by other programs. West Palm, to the south of us, uses a income-based program where they have income tax returns, Social Security check statements, and those kind of things that they go use to verify their income level. If that's something that we collectively want to continue or start to use, we can do so. But again, we wanted that feedback. And I think that was it, if I'm not mistaken. Is there another chart? I don't believe so. And then the recommendations.
Can we, Mr. Chairman, you're unmuted now.
I didn't know I was muted. The QATF received the same report and has some recommendations. We will hear those from Ms. Whittington. At the conclusion of her report, I will take questions or comments and invite Ms. Marilyn Baldwin to make any additional comments she may have from the QATF meeting. Virginia, you may proceed.
Thank you, Mr. Chairman and members. The Quality Assurance Task Force met and received the same requests, and after a considerable amount of conversation and deliberation, the following are the recommendations that they have made. With regard to separating the application process for each program, ADA and TD, the Quality Assurance Task Force recommends approval, with the caveat that a review and approval of the applications will come back to the Quality Assurance Task Force and the LCB, and that the QATF and or a task force be appointed to work with Access Links to develop and review those recommended changes to the application. With regard to the sponsoring agencies and asking whether customers or clients have another sponsor, the Quality Assurance Task Force recommends that the availability of trips by another sponsoring agency be disclosed during the eligibility process, and they feel that this could be accomplished by adding a question onto the applications. With regard to the disability, there was some concern after several Quality Assurance Task Force members have served on some of the, there have been some issues with some ADA customers and changes in eligibility, and they have served on the committee to review those repeals or appeals. Quality Assurance Task Force members are supportive of having functional assessments for TD customers, but they are concerned that some have cognitive disabilities, and to have occupational therapists conducting functional assessments is a concern for them. And they feel that if there are people who have disabilities that are cognitive in nature, that consideration should be given to adding mental health professionals who would be able to adequately assess those members of the public. Finally, the discussion point regarding access links not having a procedure in place to determine the poverty level of individuals. The QATF recommended removing individual and household income criteria and revisiting this when a procedure is able to be established. They recommend such a procedure be established in cooperation again with the Quality Assurance Task Force and the LCB. In addition, the Quality Assurance Task Force recommends consideration for requiring persons with permanent disabilities to verify and or update contact information instead of having them to complete an eligibility process each year or each 2 years. They feel that that would be a cost savings as opposed to having someone who has been given a permanent disability or been designated as having a permanent disability, that they update their contact information as opposed to having to continuously apply or be determined eligible. They also recommend that the call hold time performance measure not be increased to greater than 7 minutes as have been requested by Access Links. They feel that the 3 minutes that Access Links has been using as a measure should remain, given some of the improvements that are being made to the phone system. And during Norm's later report, you will hear that there are some additional funds that are being given to Access Links or links to provide some further enhancements that will increase the ability to be better aligned with the current measure. And then finally, Mr. Chairman, the recommendation is that a task force be formed to review the application and eligibility criteria and to work with Access Links to look at other criteria that may be needed in order to determine eligibility, such as the recommendation of maybe including the household income and such. So with that, Mr. Chairman, those were the recommendations that came out of the Quality Assurance Task Force, and Ms. Baldwin may have some additional comments.
Yeah, Ms. Baldwin, you share the QATF meeting. Is there anything you would like to add before I open it up for questions?
Can you hear me?
Yes, we can hear you.
Thank you, Mr. Chairman. I think that Mrs. Whittington has captured our concerns. The one that I really want to stress is that after some considerable thought, I strongly do not recommend increasing the call hold time to 7 minutes. This is one of the biggest concerns that I hear from riders who are working or who have limited cell phone minutes, experiencing long hold times on the phone is just inappropriate, not necessary. And I think that we can certainly, with the enhancements that Norm will talk about further and the additional funding from MetroPlan, I think that we can do better than this. So that is the strongest recommendation that I have. And also that the financial criteria not be considered until after we have a better idea about unemployment and our riders' financial needs after COVID-19. Just because someone lives in a household where there may be other income doesn't mean that income may or may not go to support that individual. And I thank Mr. Norm for the work that he and his staff have done, along with Ms. Whitten and Mrs. Whittington, to bring these recommendations to us. But those are the strongest ones that I have at this time, that we not increase the call hold time to 7 minutes, and that we do study the ideas brought before us. And then, of course, my absolute biggest is that we, as soon as possible, stop reviewing persons who are permanently disabled every 2 years. Those are my recommendations and concerns, Mr. Chairman.
Thank you so much, Ms. Baldwin. Now I'm going to bring it back into the board for any comments or question. Please don't forget to use your hand raise button and also unmute yourself so you can speak. Is there any comment or questions on these items that we just heard?
Mr. Chairman, at this time, I don't see any raised hands. I will give a second just in case. Okay, there is one hand from Dr. Linda Silverman.
Go ahead, Dr. Silverman.
Thank you. In looking at what we discussed at the Quality Assurance Committee, the last part about having, mental health, I know I discussed it at length, having mental health professionals on board or at least in contract. Norm, when do you think, is that something that can be done in a fairly short period of time to get that kind of consultant on board, or what do you think?
Well, we are currently releasing a request for proposal for a functional assessment type services. And that will be going out. We were hoping that it would be out last week, but it's going out this week from what we hear from procurement. And so in the current contract that we have with our functional assessment folks is through August of this year. So it won't be very long that we will be able to make some changes. Right now we're in a contractual relationship, as you would understand. So we can't make drastic changes just yet, but it is something that we are addressing as we speak.
Oh, super, thanks.
Thank you, Ms. Silverman. Any other comment or question?
Mr. Chairman, I do not see any hands at this time.
All right, so at this time, we're ready to take actions. I remind you that this requires two separate motions. The first is a motion regarding the proposed changes to the Access Links TD eligibility criteria. Is there a motion? Don't forget to unmute yourself and state your name when called.
Dr. Linda Silverman, I motion to approve the recommendations.
We have a motion from Dr. Silverman. Is there a second?
Second, Wayne Olson.
There's a second from Mr. Olson. All those in favor, we will do a roll call for that.
Okay, Mr. Chairman, I will start now. Mayor Alvarez.
Aye.
Ms. Arnold.
Aye.
Ms. Baldwin.
Aye.
Mr. Ballard. Mr. Ballard. Mayor Bates.
Aye.
Ms. Berry.
Aye.
Ms. Ford.
Aye.
Ms. Jennings.
Aye.
Dr. Silverman.
Aye.
Ms. Olds.
Aye.
Mr. Olson.
Aye.
Ms. Rodka.
Aye.
Mr. Reces.
Aye.
Ms. Santiago.
Aye.
Mr. Smith.
Aye.
Commissioner Uribe. Commissioner Uribe. Ms. Witt.
Aye.
And Mr. Zabritsky.
Aye.
Motion carries unanimously, Mr. Chairman.
Linda, did
Thank
you
you.
get me? This is Chad.
Okay, great. Thank you.
Sorry about that. I had
Noted.
one mute, but not the other one unmuted. Sorry about that.
Noted for
Are
the
there,
record.
are
Thank
there
you.
any opposed on this motion? Seeing none. All right, motion passed. Thank you so much, Ms. Whittington. Now we'll move on to the second motion. The next action is an approval of the Transportation Disadvantaged Service Plan, which is the TDSP, including the proposed revision to the eligibility criteria. Do I have a motion on this item?
Dr. Silverman, I motion to approve the minor updates.
I second.
Wait, Marilyn. I'm sorry.
So we'll go into discussion when we get a second, okay?
All
So we
right.
have a motion with further discussion from Ms. Silverman. Who was the second?
Was it Mr. Ballard?
Yes.
I see his hand, yes.
Thank you. Now we'll go into discussion. Ms. Silverman?
Yeah.
I see a hand, okay, he's lowered his hand. I think Mr. Ballard was just confirming that he was the second on the previous motion.
Yes, Mayor, do you have a question?
No, did you have a discussion on this item?
What do you mean?
I don't see any hands, Mr.
No, I didn't
Chairman.
raise my hand.
No? Okay, I'm sorry.
That's okay.
All right, so we have a motion and we have a second. Any other discussion on the item? All right, we'll take roll call on the item.
No, Mr. Chairman, I'm sorry, I can't see the raise hand thing. This is Marilyn.
Yes, Marilyn.
I'm sorry. I just want to ask the question, would this motion include removing the 7-minute hold time and
Yes.
making that back to 3?
Yes.
All right, very good. Thank you.
Any other discussion? All right, we'll take roll call.
Okay, Mr. Mayor Alvarez.
Aye.
Ms. Arnold.
Aye.
Ms. Baldwin.
Aye.
Mr. Ballard.
Aye.
Mayor Bates.
Aye.
Ms. Berry.
Aye.
Ms. Ford.
Aye.
Ms. Jennings.
Aye.
Dr. Silverman.
Aye.
Ms. Olds.
Aye.
Mr. Olson.
Aye.
Ms. Rodka.
Aye.
Mr. Races.
Aye.
Ms. Santiago.
Aye.
Mr. Smith.
Aye.
Commissioner Uribe. Ms. Witt.
Aye.
And Mr. Zabritsky.
Aye.
It's unanimous, Mr. Chairman.
Thank you so much. Any opposition? Seeing none, all right, thank you so much. Motion passed. I think we have to assign someone for the QATF to serve as a task force to work with links.
All right, Mr. Chairman, what we're looking for here is an appointment of either the Quality Assurance Task Force to serve along with Access Links to look at these different criteria, and any other members who would like to participate just by expanding the task force. So if there are others who would like to join the QATF, and that would be just for this purpose.
I think I see a raised hand.
I see Dr. Silverman.
Aye, yes. I would be interested in being one of those people.
Okay, noted for the record.
Okay. Anyone else?
I don't see any other hands. Thank you, Mr. Chairman.
Thank you so much. All right, now we're moving on to item AC, is an approval of the FY 2020-2021 rate calculation worksheet. Our next action item is approval of the 2020-2021 rate calculation found on tab 3 in your agendas. This item will also be incorporated into the TDLCB. Do I have a motion to approve this item? Please don't forget to use your raise hand button and unmute yourself.
So moved, Uribe.
We have a motion by Commissioner Uribe. Do we have a second?
Janae Olds, I second.
All right, so we have a motion by second by Janae Olds. We're gonna do roll call. Ms. Whittington?
Mr. Chairman. Mayor Alvarez.
Aye.
Ms. Arnold.
Aye.
Ms. Baldwin.
Aye.
Mr. Ballard.
Aye.
Mayor Bates.
Aye.
Ms. Berry.
Aye.
Ms. Ford.
Aye.
Ms. Jennings.
Aye.
Dr. Silverman.
Aye.
Ms. Olds.
Aye.
Mr. Olson.
Aye.
Ms. Rodka.
Aye.
Mr. Races.
Aye.
Ms. Santiago.
Aye.
Mr. Smith,
Aye.
Commissioner Uribe,
Aye.
Ms. Witt,
Aye.
Mr. Zabriskie.
Aye.
It's unanimous, Mr. Chairman.
Thank you. No opposition to this motion? All right, seeing none, thank you so much. We'll move on to item 9, presentation and status report. We have 3 presentations today. Please use the raise hand function to be recognized if you want to ask a question. You may raise your hand during the presentation to indicate you want to ask a question, but we will hold all questions until presentation ends. If you're having audio issues, you can type your question into the chat box and a moderator will relay your question. Please go ahead with the first presentation.
Well, good afternoon, or excuse me, good morning again, Mr. Chairman and all the members of the board and all participating in this meeting. Here is the update for the quarter from us at Mobility Services. And it's been an interesting quarter to say the least. And I am trying to advance.
I think you may need to click the, there you go.
Okay, that's fair. So through the first quarter of this calendar year, we wanted to provide you just a little bit of an idea of the activity that we've been doing. And you can see there we have January, February, and March. You can start to see when we came to March that we're starting to have the dip with the number of rides, and we'll talk about that just a little bit. But during this first quarter also, we were able to make some technological improvements, and we're very proud of those. Was previously mentioned, we were able to finish the web access upgrade, which is the computer access for anybody that wants to go make their own reservations. I know we talked a little bit about hold times in the past, and as Ms. Baldwin made very eloquently, that people can't, they don't have a lot of minutes, or they can't wait all day. Having the web access is really very available. They can make anytime, 24/7. They can make their own reservations for any access links rides that they need to make. We've really attempted to work out all the bugs from the old system, make it very user-friendly. All of our mobility services reps have been trained to walk somebody through, and then we even have some experts that if you really have difficulties and need to be walked through on how to set up an account, and or because you're having some technical difficulties, we think we can help you. We believe that's going to help us go a long way towards, one, promoting a better customer experience, but also reducing the amount of phone calls that have to come in making reservations. So, of course, just as we rolled that out, then we had COVID-19 come along, so we really haven't had a chance to test it in a full rate practice, but we certainly have been making a lot of phone calls to a lot of individuals to get them signed up, and so that when we do get back into some new form of normal, that they will have that available to them for their mobility services. We also, something that was long overdue, was update the base map that we use for scheduling all of our rides. I know we've had concerns in the past, and a little over a year that I've been here, about going from one side of the Central Valley or the Central Florida area here to another location, and seems like the routing wasn't very efficient and didn't make a lot of sense. We know that with this base map upgrade, that now we got better GPS information in there. It's upgraded with all the changes that have gone on the geography and the road changes and the changes that are constantly going on the I-4. So that's going to make it a lot easier, a lot better for our scheduling process and actually route mapping when we do that. We made a commitment to this board and to this community, and the board of directors for Links has been very gracious in providing us with the ability to go out, and currently we have 63 new Access Links vehicles on order, and the first 3 have already started to show up, and then we have 15 NeighborLink vehicles. Well, we know these vehicles are going to replace a lot of vehicles that were very old, their useful life is done, and we'll get those old ones out of the system, and we get these much nicer brand new ones. We also have board authorizations. Now, we have not made put purchase orders out for these additional 15, but we have board authorization for an additional 15 access link vehicles to, again, fill the need that we have in the community, and they'll be ready to go when we get to the new normal. And let me go to the next slide here. Might not. There we go. Did I go too far? No, sorry about that. One thing we did want to do, though, we've been the last quarter, we've been very busy as part of our duties as the CTC. Links has been out there working with these different agencies in developing a coordinated agency contract. These are agencies that they don't get any money from Links, but what we do is we have a partnership with them, and that partnership allows us to go count the trips that they perform on behalf of their constituents, and then we go out and we do inspections, but it also gives them the opportunity, because they have that contract, that they can go ask for grants from other funding organizations, whether it be in the health department, whether it be from the federal government or from the state, and they can use this contract that we, in this relationship that we have as the CTC, to go ask for those funds, and it works out very well for them. We're very happy that we've had the opportunity to upgrade this system, and so we wanted to show that it's something that's important to us. A lot of these individuals would, if they didn't have these transportation opportunities and mobility services provided by these organizations, they would be on our access link system. So again, this is it's good for the taxpayers, the fact that we're having this partnership. Next slide. So COVID-19, it came upon us during this quarter. And quite frankly, we've all had to learn how to do business differently. And some of the things that we had to do was immediately we saw a 50% reduction in our trips. That was a combination of both ADA and TD. Now, as Access Links, we never stopped providing rides. We never limited rides. We never prioritized any rides. We just met the demand that was presented to us every day, day in and day out. But we have seen a 50% reduction. We're starting to see that trend come back up just slightly. And so we hope that folks will begin to explore more mobility as more places within our Central Florida service area open up. But we have been ready to take them where they need to go at any time. As I said, we maintained the service and staffing. We did not lay off any operators. We did not reduce the amount of vehicles out on the road. We maintained service here, and that's something that's really a real benefit and a real, I think, a kudo to Links and the management team and the board of directors, that they kept everybody here practicing what we are here to do on behalf of the community. Now, we have been practicing social distancing when we schedule trips. Today, we only have one person at a time on any one vehicle out there in our service area. Now, a person can bring a companion, or they can bring a personal care assistant along with them, but we are not doing the normal shared ride service that we normally do. We've really been trying to keep this very distant for the health of the customer, first and foremost, but also for our operators and all the people that take care of making sure the vehicles are out and operating properly. As we said, safety of our operators and passengers was our first priority. We've been sanitizing 100% of our vehicles each and every day. Each of our employees and operators have had personal protection equipment provided to them so that they would feel safe and also be safe for our customers. We also, on behalf of the board of directors who implemented this, put a no fare collection policy in place. Now, the board has extended that through the end of this month. Now, whether it's extended further, that will be a discussion that has to take place at the next May board meeting, and that may be extended through June. We don't know yet, But again, that was done so that there's not an exchange between the operator and the customer, forcing them to give them dollar bills, etc. The entire mobility services operation was moved out to a remote operation. So all of our employees, all the MSRs, because of the ability to go get a new service that we are in a temporary mode with, it's between 2 months and 6 months that we are under contract, that we are really, it's an experiment. It's a live experiment, and so far it's been successful, but all of our mobility services representatives are working from the safety of their own home so that they're not having to commute, not having to go around any kind of orders that were given by the local authorities as far as curfews. And they could also, whatever kind of family issues that they had to attend to or health concerns that they may have had, they could deal with that in the safety of their own home and still, however, be paid and still be employed and still operate. And so far, it's been very good. But it's also teaching us too how to, as we move into the new normal, how to continue on the business and what improvements we can make. And part of that has been the phone system. Right now, when you call into a mobility services rep, it's not coming into the call center anymore. It's going right out to them. It actually is routed through Dallas, believe it or not. And it goes into a computer system that Lynx has provided, and they answer it through their computer, and they are able to make the reservations right there, again, working from their home, and it's been seamless. Now that you voted that we can only have a 3-minute hold time, which is fine, because and we appreciate the feedback. I will tell you right now, the answer rate in most of the calls has been about 30 seconds. But before I go do a touchdown dance or anybody else in mobility services spikes the ball, we know we're about 1/3 of the quantity of phone calls are coming in right now than we had the beginning of the year. So we're getting about 1,100-1,200 calls a day, maybe 1,400 on a higher day, when a normal would have been 2,800 to close to 3,000 calls. So we'll see how this works out as we increase the demand, et cetera, but we think there's going to be a lot of benefits, and we have an opportunity to learn from what we're finding out right now, which also gives us information for our director of IT, who is currently looking at a brand new phone system for the Lynx organization, which also will then help us have all the different features that so many on this board have asked for, such as being able to be notified where you're at in the queue when you call. How many minutes is it on average that you're going to have to wait for the actual being able to talk to our representatives? The new system that we're planning right now will ask you, would you like to hit a number? And if you hit that number, you'll get an automatic phone call back when you get down to like the 3rd in the queue, so that you're not having to hang on the phone. You can go back to work, you'll get an automatic phone call back, and then you can talk to a rep as you get answered. So we see that as a real benefit. We see this opportunity. We tried to make a real positive out of this really serious pandemic situation that happened. And it's given us a lot of opportunities to experiment, as I said. And then also what we've done, we've been asked and called upon Orange County. They asked us to do some very specific rides. And so the Mears Taxi organization, they were very willing, and we really appreciate their effort to do COVID-19 testing trips. That way we were able to keep those types of trips separate from the normal access Lynx mobility trips that we provide. Again, focused on the safety of the customer, focused on the safety of the operators, and then that way they gave us a chance to go really keep everybody safe, understanding in case we have to trace down where a problem may have arisen. And we haven't had any problems to this point, and we're thankful for that. But again, Mears Taxi, if you happen to see them, they did a great job in stepping up to doing that type of work for us. Next slide is, as I mentioned, we went through as Mobility Services our biannual review from the CTD. That was conducted on May 6th and 7th. And it was a unique review because we had to do everything from a virtual standpoint. And it was for the period of July 1, 2018 through June 30th of 2019. And so the reviewers had asked for a tremendous amount of information, and we provided those documents to them via electronics, and they were able to review. During the 2 days, they asked for another a large amount of information like our TDSP, our annual operating reports, many of our other measures that they wanted. Fortunately, and we think it was very fortunate because we answered all their questions. They did have one finding, and I wanted to share that with you. That finding had to do with the way we prepare the annual operating report. While we at Lynx had a procedure and a policy on how we did the preparation for the report, they felt that it could be much more instructional in nature, have much more detail in nature. And so that's the finding. And you can see I put it in the slide here. I don't need to read every portion of it, but they want really step-by-step. They want to have definitions of who, different positions, who is actually responsible for getting the information, who submits the information, et cetera, and a timeline for each year. So we will be working on that to answer that question for them. And they will be giving us a timeline that we have to have that corrective action done. Now, they did have a couple more items. They had some suggestions. One was a formal internal policy and procedure for a periodic assessment of our vulnerabilities as an agency. Excuse me, apologize. Making sure that we're tracking any kind of fraudulent activity. We have these types of things. We have them in our safety and security plan. We have them in our IT plan. And what they are asking for us to do is really put them together in one document, if you will. Now, these are only suggestions that they're asking for us to do. They weren't findings, which we appreciated. They also ask us to do periodic background verification and checks on our existing staff. Now, operators go through updates on an annual basis, but they're looking for admin staff like myself and most of the people in mobility services. So that is something that is being worked on by our human resources staff. We just don't have a timeline just yet because there's collective bargaining issues, and want to make sure that everybody is equal as to how these checks are conducted, et cetera. And then we've already addressed the last one, which was a suggestion, and it was timely on their part, and it was we didn't even know that they were going to bring it up, but at the exit interview, not adhering to the eligibility guidelines as they are established in the TDSP. So I think we've taken that first step, and again, very thankful for the feedback from the Quality Assurance Task Force and to all of you on the local coordinating board for that feedback. This is going to make it much easier as we go forward, working together, that will redefine the eligibility requirements, and then we'll have what our practices are will be documented in the TDSP. So we look forward to that. The draft report will be out in May 29th, and we'll have 30 days after that to get the final report. So I believe that is everything, if I'm not mistaken. So glad to answer any questions that anybody might have.
Thank you for your presentation, Mr. Hinckley. And I see that we have two raised hands. We'll move on now to any comments and questions. I see two raised hands, Dr. Silverman and Ms. Let's see the other hand that I see up here, Ms. Baldwin. So Dr. Silverman, and then we'll move on to Ms. Baldwin.
Yes, thank you, Dr. Silverman here. I have a question, Mr. Hinckley. You mentioned, or I saw on the screen, that through the 31st of May, that's when you're talking about not having any fares collected. Is that the same as everything else you were talking about? For example, the the solo rides, not having anybody but a caregiver going with the rider that's the first question. So is that the same time frame, or how long have you're just going to play it by ear, or maybe 3 months from now you're going to revisit that?
That is just our current practice. And again, we're going to look at that day by day.
Okay.
We'll see how the demand goes, et cetera. We're doing social distancing on our fixed route. So we want to make sure we're continuing to do the social distancing on our access links. We want to do that as long as we're physically and capable to do that. And then
Okay.
even then we would minimize how many individuals would be on a vehicle at any one time if we make any changes.
Okay. The second part of that is, what are the passengers that come on board, what are their requirements? They have to wear gloves and a mask, or what are you asking for riders?
We are asking, we would prefer that they wear a mask. We are not absolutely requiring it. We're not refusing rides if they don't.
Oh,
Now,
okay.
if somebody does come on the vehicle, and again, we've coordinated this with and checked with and made sure we're in proper standing with the FTA. But if somebody does come on and they are coughing profusely or show signs of maybe that they are infected or have just a really bad cold, it may not be the virus, the operator does have that option or he or she to say, no, I'm not going to take this ride. So we were asking people, if you feel like you're sick, one, wear a mask, but if you feel like you're sick, don't ride at all. No, just keep it to what you absolutely have to do, and let's protect everybody's health.
Right, but the drivers are wearing masks.
The drivers are, yes, and they're given a kit. They got masks, and they also have hand sanitizer, and they also have a cleaning kit, so that as each client gets out, then they can wipe down the area so that it's safe for the next client.
Okay,
as they get in.
great. Thank you very much.
You're welcome.
Thank you so much, Dr. Silverman. Ms. Baldwin? You had a question?
Thank you. Yes, thank you, Mr. Chairman. Question and comment. Norm, I'm very pleased to see that you were involved in providing trips for individuals who might have needed to be tested for COVID. How did this come about, and how was the public notified? A lot of members of our chapter, National Federation of the Blind, Central Florida chapter, expressed concern about if they needed to go get a COVID test, how would they get there? And I have to say, as an advocate, I didn't have that answer. So this again goes back to maybe enhanced communication. This would have been good to know.
And understand, and this has only been going on for probably 10 days now, maybe at the most. It happened very, very quickly. We had a request that came in from our original policy was that, no, if you said you were going to a testing site, we were not going to be able to take you to that test. We did have a request that came in from the Orange County Emergency Operations Center, and we worked with them for 3-4 days, and then we worked very diligently trying to find a organization that would be willing to go take the necessary precautions, but 2, dedicate some vehicles that were separate from our standard fleet and be able to take these testing trips. So yes, we can certainly get that word out there. We have shared with the Emergency Operations Center that it's available. It's not something that we have advertised, admittedly, only because it's a limited number of vehicles and we just don't want to disappoint. Plus, somebody needs to have an appointment with the health department in order to go to a test facility. So, so all these things kind of came together very, very quickly, but your point's well taken. And obviously, always it is.
Very good. Thank you.
You're welcome.
Thank you so much, Ms. Baldwin. Anyone else has any comment or question?
Yes, this is Carla Radka, and I have a comment and some information that I would like to share. About 6 weeks ago, Governor DeSantis established an initiative with the restaurants to be able to feed seniors and individuals with disabilities across the state of Florida. We implemented that program locally, and we call it Meals of Love. Today, with a network of 15 restaurants, drivers through a partnership with Career Source, and we're still in need of drivers. So that's part of my ask and desire to make this comment to engage Norman and William John Slot in this conversation. So through that initiative, we are feeding individuals with disabilities, adults with disabilities, and seniors daily. We are providing 2,500 meals a day with this initiative with 15 restaurants. That adds to all of the other funding that we distribute in the community for the Meals on Wheels programs through Meals on Wheels in Sanford, Osceola Council on Aging in Osceola County, through Seniors First in Orange County, and through Aging Matters in Brevard County. That combines, we are distributing 44,000 meals a week directly to the homes of seniors. We do not have congregate sites right now to feed seniors, so all those meals go directly to their homes. So back into the Meals of Love and the 2,500 meals that we're distributing through this very new initiative, we are in need of matching funds. This is part of the CARES Act funds and the Family First Act. All these extra meals, all the money that we have put through our network organizations. And my ask for links is two things. One is that I would like to know if you are welcome a conversation to look for driving opportunities for meal distribution, and second, to support this initiative to feed the most vulnerable members of our society for COVID-19, which are our seniors, and for potential opportunities for matching funds, financial support for this program. We are fully engaged on feeding seniors 7 days a week with nutritional, delicious meals created in restaurants, which is also helping the economy and helping restaurants, which is one of the key industries in Central Florida and one of the key industries that have been the most affected during COVID-19. So that is my statement and my comments for William and for Norman. And for the rest of this group is an invitation that if you have a senior or if you would like to learn more about this initiative, we have a website, which is mealsoflove.org. Or for all services provided through Senior Resource Alliance, you can visit seniorresourcealliance.org. Thank you.
So before I go to anybody else that has any comment or question, I want to ask this board, for the sake of time, that we stayed on the agenda. There's an item at the end of the agenda, which is members' comments. And so members are going to be able to bring their own comments and suggestions, but we're sticking to the agenda items. So any comments or questions in reference to the presentation that we just received right now?
Yes, this is Tamika Monterville, Director of Planning and Development with Links. I wanted to add to Mr. Hickling's presentation with regard to the transportation services provided by Links. One of the things that has occurred is with the enacting of the Orange County Emergency Operations Center, Links is an ESF1 function, which is transportation. And so under that role, Links may be requested to provide transportation services. So to Mr. Alvarez, Mr. Chair, that is one of the reasons why for this particular delivery of service, the information was not publicized, because it was a request specifically from the EOC, and Links' function as an ESF1 transportation provider. Thank you.
Thank you so much.
You're welcome.
Any other comments or questions in reference to this item?
Mr. Chairman, I do not see any hands at this point.
All right, so we'll move on to the second presentation. The second presentation is the CTC evaluation result, and this will be given by Ms. Whittington. Go right ahead.
Good morning.
We'll
again,
leave
Mr.
all the comments and questions to the end.
Okay, good morning again, Mr. Chairman and members. I'm going to try to, in the interest of time, get through this very, very quickly. The Florida Transportation Disadvantaged Commission, that is the TD Commission, they oversee the coordination of the local TD service providers throughout the state. And at the local level, the CTC coordinators or the community transportation coordinators are responsible for the provision of that service. Florida Statute 429 and Rule 41 -2 outlines the duties of those CTC coordinators, as well as the responsibilities of this board, the Transportation Disadvantaged Local Coordinating Board, one of which is you are responsible for evaluating the performance of the CTC. You're also responsible for approving the annual service plan, which you just took care of, and all of the comments and questions related to this evaluation are included in that TDSP, which Ms. Whitten referred to earlier. With the CTC evaluation, it is an annual requirement. Unfortunately, there was an inadvertent action that took place at the legislative level in 2017 that temporarily suspended this board's authorization to evaluate the CTC, but that has been remedied and we are now back to having those annual evaluations. Members, you will recall back in January, we sent out a packet of information to you, an instrument that you were to use to conduct the evaluation at your February meeting. However, due to much conversation at that meeting, you postponed the evaluation until May. And then COVID happened. And in order for us to make the best use of the time, we sent out an electronic poll everywhere survey for you to use to submit your responses to the evaluation. A link was sent to you on April 16th with a reminder on April 28th, and then the survey closed on May 1st. I'll also remind you that the evaluation period covers July 1st of 2018 through June 30th of 2019. The evaluation covers 5 broad areas: coordination, administrative, cost effectiveness, local performance measures, and availability. Each of these have several subcategories. And so as we go through these, we will share with you the results of the survey. I will let you know, Mr. Chairman and members, that of the 19 members on the TDLCB, we received responses from 13, representing about 68%. The first category is operations, and under operations, we find the planning. And in fact, these next 3, the results were exactly the same. 92% of the respondents felt that Access Links meets the standards with regard to planning. And this ensures that the TD transportation services complement one another, meaning that the services are not duplicated and that the TD transportation needs are not omitted. 8% of the respondents felt that Access Links is below standards in this area, however. With regard to transport availability, or Access Links ensuring that the appropriate vehicles are available for the clients, again, 92% of respondents felt that Access Links meets the standard, while 8% feel that they fall below the standard. With service monitoring, which means that the Access Links meets the standards and properly monitors or resolves transportation problems, including passengers and the contract service providers. 92% feel that Access Links meets this requirement, and 8% again feel that they fall below the standard. With regard to billing, in the billing category, 8% of the respondents feel that Access Links exceeds the standard when it comes to having coordinated billing system, which they properly collect fares for trips based on funding availability. And 92% feel that Access Links meets the standard. With regard to reporting, in the category of reporting, meaning that Access Links provides accounting, operating statistics, and measures related to certification and billing, as well as other information to the TDLCB. 8% of the respondents feel that they exceed this standard, and 84% feel that they meet the standard, but 8% feel that they fall below the standard. In other words, that the information is not provided to the TDLCB. With regard to coordination administrative, the first category here is eligibility, records, and certification. 77% of the respondents feel that Access Links has created a user-friendly enrollment system to determine a user's eligibility based on specific program funding criteria, and 23% feel that they fall below the standard. Given the conversation that you had earlier with regard to the TDSP and the eligibility criteria, you will probably see some changes, and this number will realize some improvement over the next year. With regard to reservations, reservations are created in a user-friendly reservation system where riders can reserve trips on the phone call, or through an online reservation system. Again, 77% feel that Access Links meets this standard, while 23% feel they fall below or that is unacceptable, 8% and 15% respectively. With trip allocation, noting that Access Links' assignment of trips is efficient and effective, and that trips are based on predefined criteria consisting of cost, capacity, and rotation, match of service, or multi-loading. 8% feel that this is unacceptable and that they do not meet this standard. 8% feel they exceed the standard, and 84% feel that they meet the standard. I think I went too far there. I'm not gonna, let me see if I can back up. And there's the slide. I'm sorry, I had gone too far with trip allocation. Next is the scheduling. Access Links has a scheduling process in which all TD trips are scheduled via a single request. 92% feel that Access Links meets this standard, while 8% feel that they fall below. Moving on to coordination of providers. During this reporting period, Access Links implemented a mobility services model, which uses other shared use providers and transportation network companies. 8% of the respondents feel that Access Links exceeds this standard, while 92% feel that they meet the standard. Moving on to cost effectiveness. This third broad category covers cost effectiveness and efficiency. The LCB was provided with a comparison data to determine whether Access Links is delivering the most cost-effective transportation. Based on the data provided, the question was, has Access Links delivered the most cost-effective and efficient service? 69% felt that Access Links meets this standard, and 31% felt that they fall below the standard. In the area of local performance measures, in this section, respondents were asked to rate how Access Links performed compared to performance measures that were established by this board. First is on-time performance. During the reporting period, the TDLCB's on-time performance goal was 91% or greater. During the reporting period, however, Access Links' average on-time performance was 94.45%. 85% of the respondents felt that they satisfactorily met this goal, while 15% felt that improvement is needed. With regard to call hold time, in other words, the time that it takes for a customer to place a reservation or make an inquiry is a measure of quality, and the TDLCB established an average hold time goal of 3 minutes during this reporting period. Access Links' average hold time was nearly 6 minutes at 5 minutes and 42 seconds. 23% of the respondents felt that this was satisfactory, while 77% rated this as needs improvement or unsatisfactory, 69% and 8% respectively. With commendations and concerns, Access Links has established a customer relations line that handles and monitors the level of compliments and concerns that are received. All information received is documented in a database, and the case is assigned to a supervisor based on the type of compliment or concern received. The LCB established a goal of less than 3 valid concerns per 1,000 trips, and the average complaint per 1,000 trips during this reporting period was 2.33. 85% of the respondents felt this was satisfactory, and 15% felt that it needs improvement. With regard to availability, 2 areas are under this broad category. First is demand. It is Lynx's policy not to deny trips requested for any eligible customer, no matter which fund pays for the trip. Lynx funding partners attempt to provide enough funding to meet 100% of the demand on the Access Lynx program. For this evaluation period, there were 0 unmet needs. 92% of the respondents felt that this was satisfactory, while 8% feel that improvement is needed. And then customer service accessibility. For customer service accessibility, evaluators were asked to rate Access Lynx's ability to provide scheduling and transportation service availability. They were to consider whether reservations could be made during the established times of between 8 and 5 p.m. 7 days a week, and that those with access could also make reservations online 24 hours a day, 7 days a week. 69% of the respondents felt that they satisfactorily met this measure, while 31% felt that improvement was needed. And public awareness. Access Lynx staff conducted 65 public outreach presentations during this evaluation period. Raters were asked, based on his or her level of awareness and or conversations with TD customers, how well Access Lynx had done to reach the TD community. 77% rated this satisfactory, 15% said that improvement is needed, and 8% felt that it is unsatisfactory and that more outreach should be done. The overall evaluation was the last category, and based on the responses, the overall evaluation of Access Lynx is that 85% of the respondents feel that Access Lynx meets their standards, while 15% feel that they are below standards. Mr. Chairman and members, there were several comments that were presented with responses. And for the public who may be joining us and are unable to read the screens, I will go through several that are here and let you know that we have passed others on to Access Lynx that were not really applicable to the evaluation, but had more to do with questions and concerns that they had, and that we asked Access Lynx to follow up. A few of the comments, I think Lynx is doing a good job in general, and there are some areas that need improvement. Another comment is that the average on-time performance goal may need to be increased to help ensure individuals arrive at their destinations in a timely manner. Next is report improve call hold times and eligibility to the LCB on a regular basis. In other words, the evaluator wants to hear improved call hold times more frequently than they are receiving. Another comment was that Lynx will continue to work on improving TD services in our community. The call hold time and scheduling are always a challenge. If clients are permanently disabled, we should not have them go through eligibility every 2 years. This action alone would save money and reduce unnecessary burdens on the riders. And then finally, the final comment, the wait time, timeliness of service, and communication between providers needs improvement, and that should be able to partially resolve within the next 6 months. Mr. Chairman, this is the results of the CTC evaluation that was conducted by this board. We will compile this into a report and submit this to the CTD as is required. And I'll answer any questions. Oh, just need some water.
Thank you so much. Thank you so much, Ms. Whittington. And any comments or questions in reference to this presentation? And I see none.
One hand from Commissioner Uribe, Mr. Chairman.
Commissioner Uribe.
Hi, Virginia and everybody. Thank you so much. Virginia, I just wanted to ask again, do you know how many results we got back and how many people were asked to participate?
Yes, Commissioner, this evaluation was completed by the members of this board, the Transportation Disadvantaged Local Coordinating Board. Of the 19 members, we received 13 responses. The other 6 did not respond.
Thank you.
Any other comments or questions in reference to the presentation? All right, well, thank you so much, Ms. Whittington.
Thank you, Mr. Chairman.
All right, we'll move on to the final presentation, which is the update on the 2045 Florida Transportation Plan. And this presentation will be given by Judy Piso.
Thank you, Mayor Alvarez. I'll try to make this quick. I see our time is quickly going through. Let me make sure I have control. Some of you may say, well, yeah, I've already heard the update to the Florida Transportation Plan last year. Well, there's actually 4 campaigns. There's the technology and resilience that you would have heard last year. I am presenting today the statewide interregional and the regional and local. So I thank you for letting me be here today. It's very important to present to the transportation disadvantaged because you best know what your needs are. And this is your opportunity to incorporate those concerns and those needs into this update. So let me see if I can advance this. Yes. Okay. I'm actually having to work from 2 screens because my notes are on my computer. All right. Why this is important. For those that are on the phone, I'll try to also describe some of the slides that I'm talking about. The slide that I'm showing here is actually showing some past policies and reports that have been generated. I won't go into them, but they fuel this update. We pull from that as well. But 2 that I do want to address that are current is the 2020 Florida Transportation Plan, which was adopted in 2000. It included an emphasis on coordinating and supporting regional vision and collaboration needed to achieve the visions. This also has the 2060 Florida Transportation Plan, which was adopted in 2010. This brought about a much more economic-centered approach to transportation policy, including alignment with the Florida Strategic Plan for Economic Development and the Florida Mobility and Trade Plan. And also on that note, the Freight and Mobility Plan was recently adopted. Update was in February of 2020. And as we develop this current update, we'll draw upon the SIS and statewide modal planning for critical information, including key issues, trends, and needs assessments. So moving forward, I'll describe this slide again for those that may be on the phone. This slide shows the goals and elements that relate to these. The current update has 3 elements. The vision element is looking out 50 years. A policy element with a 25-year horizon, which matches up with the MPO, Long Range Transportation Plan, and an implementation element. The update to these, Florida Transportation Plan may also include a 4th element, which is the performance element. The goals from the last update are remaining largely intact. Refinements made to them, such as linking transportation choices to improvements in accessibility and equity, very important, reflect input from our partners and the public. That's why I am here today. The goal areas are representative of the themes that have historically been highlighted in our past Florida transportation plans and consider emerging trends, technologies that are impacting the transportation system. Objectives identified for these goals often overlap goal areas. And this update of the plan will consider objectives and strategies within the 4 cross-cutting topics to better align the objective and strategies and provide clear direction for implementation. Those topics, as I stated, technology and resilience, I discussed last year, and today is state and interregional and regional and local needs. So looking at this slide real quick, the goals that we're addressing: transportation solutions that enhance Florida's environment, safety and security for residents and visitors and businesses, agile, resilient, and quality transportation infrastructure, connected, efficient, and reliable mobility for people in freight, transportation choices that improve accessibility and equity, transportation solutions that strengthen the Florida's economy, and transportation systems that enhance Florida's communities. This slide goes more in detail of the four cross-cutting topics. I'll read that for those that are on the phone. Under technology, we addressed last year the automated, connected, electric, and shared vehicles, transportation management and operations, also known as TISMO, big data, new materials and processes. Under resilience, and I want to emphasize, under resilience, we have economic and societal changes as well as environmental changes. We have extreme weather, emergency evacuation and response, sea level rising. State and regional, which I'm addressing today, we have SIS, including modal facilities, trade and logistics, multi-use, multimodal facilities, global, statewide, and interregional connectivity, and Florida's economic drivers and industries. For regional and local, we're looking at urbanized, non-urbanized, and rural, looking at congested areas. We're looking at land use and community planning, regional vision, again, the environment, can't have enough on that, and economic development. So emerging trends for the 4 cross-cutting topics that have been identified, updated, and for this update and been documented in those emerging trend handouts available on our website, which I'll show you the link at the end of this presentation. Technology is offering new ways of traveling and changing the way we move freight, our behavior, and how we use, share, and manage data. Trends, including addressing resilience, which, especially in Central Florida, need to be integrated more fully into our planning and project development and other processes. Among the important questions to consider, one should think about this because I'm going to be asking you questions towards the end of this presentation. What natural hazards impact our transportation system? And this does greatly affect folks who are transportation disadvantaged. What types of extreme weather can affect the mobility of Floridians? And how can our transportation system for residents be evolving and working with the economic trends? And how can we better understand how our transportation infrastructure is vulnerable to hazards and threats? So trends relating to state and interregional transportation encompasses multiple modes and focuses on linking regions together into a single state and connecting Florida to markets around the nation and the world. And I've already addressed what some of the potential areas to cover under regional and local roads under those cross-cutting topics. And just to real briefly remind you, that was the congestion relief, land use community planning, regional vision, issues and interests of urbanized, non-urbanized, and rural areas, and the environment and economic development. Now I'm going to put you to work. This slide I'm actually going to skip because I'm going to ask the staff that's helping to facilitate this to go ahead and give me a list of folks that attended. So I don't need to address this. In the interest of time, we're going to move on to some of the other slides. So I am going to ask you, and I'll read the choices, but what trend do you feel is the most important to and will have the biggest impact on Florida's transportation future. And the choices are resilience, technology, funding, revenue, cost of transportation, sustainability, demographic shifts, population growth, evolving processes and decision-making, new ways to travel, preservation of environment, economy, safety, and less need to travel. You can key that into your chat box, what you feel is most important. And you can expand on that if you want. There are no wrong answers. So this is an opportunity to respond as to what you feel is the most important. I'll give you a few moments.
Judy, the answers are starting to come in. Folks are typing away. Got a couple of folks who said funding so far, one who said safety.
You can add, yeah, you can say funding for sure. Okay, do we think that's kind of calm? No, folks are still responding.
Another funding. Seems
you.
to be the most popular one right now. We'll maybe give everybody a few more seconds to type that in. You can perhaps just type in the first word or two, folks. We can figure out what you mean. All right, lots more safeties and funding, and we have one new way to travel and preservation of environment. But I believe your overwhelming winner here is funding.
I don't doubt it. More comments coming in. Thank you. I appreciate your input.
Yes, it looks like the responses are slowing down at this point, but if you're still typing, go right ahead. We're going to be providing Judy a record of this so that she can make sure to take your input into account.
I'm leaning towards the less need to travel. I've really enjoyed this teleworking. I like to tell folks, it's Heather Garcia, my supervisor with the department. It's going to be tough for her to bring me back into the office. It's kind of nice out here.
We have a couple more evolving processes, and then Joe mentions, other than funding, technology needs to be updated or addressed, and safety of bicyclists and pedestrians in the process as well.
Good.
And I think all of our elected officials said funding.
All right, I'm going to move on. Okay, in this slide, we're asking again for your opinion. What is the greatest challenge for Florida to overcome related to changing technology in our transportation system? We're looking at regulatory barriers, rapid rate of development and adoption of new technologies, integrating old, existing, and new emerging technologies in the same system at the same time. Trust me, that's a big challenge for my agency, for the DOT. Planning and design challenges, interesting, and data security and privacy, considering some of the local governments having been hacked. It's definitely a challenge. There are no wrong answers. You can even, if something else comes to mind that's not in this categories that I've provided on the screen, you can add your own. There's no wrong answers.
I have a couple of folks who have said integrating so far, and two that have said security, so evenly split at the moment.
Mm-hmm. Well, the next two slides are going to allow you to really expand on your own experiences and thoughts. So I have two more slides where you'll be interacting with the presentation.
Lots of integrations and security answers coming through, Judy.
Thank you. Okay, we've got a few more minutes. I'm going to go ahead. If we slow down on the keying in.
Yes, we're slowing down a little bit.
These next two are pretty important. These next two are your own thoughts, your own concerns in what regional or local needs should be considered as we update the Florida Transportation Plan. So from your experiences, you're out there, you know what you're up against. What are some of the needs that you would like to see integrated into this plan? By the way, a little bit of history, this plan is a federal requirement of all states to update our transportation plans every 5 years. So this is a very important document. So you again can key in your thoughts. No wrong answers.
And so far, we have a couple of answers. The first is integrating technology due to rapidly changing tech and lack of funds and potentially a lack of vision, and also population and funding again.
Well, you're considering population. I'm going to plant some seeds. Consider the age of, we have an aging population. It seems like we have extremes going on right now with the aging baby boomers and the younger generation coming through, and what are their transportation challenges going to be, especially for our aging transportation as population. What are they going to do in the way of transportation? And I know that's something that's foremost on your list here.
And we've had several more come through considering funding needs.
Right.
Yep. Lots more. Okay, population and demographics. Someone agrees with you that it's important to look at those needs of seniors and providing a vision of the community, a long-term vision where we can use available funds accordingly to support that. And we've got a couple more answers on integration of technology and funding and population growth.
Okay, we slowing down here?
Yes, ma'am.
Okay, I'm going to move on. This next slide too offers you an opportunity. Whoops, let me go back a slide. How do I back up? Back up, back up, back up. Whoops. Okay, this one is about strategies to increase statewide mobility for people in freight in the next 5 to 10 years. So this is a little bit deeper. What are some strategies do you think that we can assist people for mobility? And I know funding has been a very common theme through this whole thing, but let's come up with how do we get people moving? How do we get freight moving in the next 5 years? Are we looking at more roads? Are we looking at more buses, trains? What are we considering? And the sky's the limit here. This is your opportunity to put in your favorite fantasy, seriously. And as I have said repeatedly, there are no wrong answers. This is your opportunity to tell us what you would like to see. I'm not making
one response on education so far, and the members can go ahead and feel free to continue typing.
And that's a very important one, educating the public about what is available out there and what they can do. Also educating elected officials, appointed officials.
We've got answers on public transportation, funding and education, and also increasing the use of trains, maybe looking to other places like South Florida was noted here. Need better train usage for passengers, this area and north.
Yes. Okay.
Commuter rail, encouraging the use of that. and education again. And we're slowing down a little bit, but we just had a couple more come through, addressing how funding is distributed to roads versus transit, and looking at how we can shift more people to transit and rail. And another response has to do with increasing telecommuting ability so that we can decrease our commutes.
That has my vote.
Yep, and increasing the availability of freight to move that around more easily, and also integrating the integration of a more expanded trained system. And outreach and education is another response. So I think we're slowing down on the responses, Judy, if you'd like to move forward.
Well, I'm going to wrap up now. I just have 2 slides, my wrap-up slides, which you had a brief look at. So what do we do with this information? Well, all input, all the information that we've gathered here today and in past presentations is received, organized by the project team, and presented to the diverse 30+ member steering committee who is guiding the plans update. More information is available on the website, which I'm going to show you in the last slide, including information on cross-cutting topics. There are multiple ways to get involved, ranging from completing the online surveys that are available to providing comments using the general feedback form. Also shown is the update schedule for 2020, which is subject to change due to the COVID-19 virus. We do have planning for the regional workshops. It's currently on pause. We're looking to try to do those virtually so that, as you know, can, from your own experience here today, it's a daunting task. The draft plan will have a 30-day public comment period, and we anticipate the plan to be wrapped up in December. So looking at this right now from May to June, we should be doing our regional workshops. Again, they may be virtual. It's still a work in process. July to August will be the draft of the policy plan. And then from September to October, we're presenting the policy plan to management. In November will be the public comment period. And as I stated, December, we hope to have this finalized. Let's see. We'll go to the last slide. This gives you the website address. This is a screenshot of that website for the transportation plan update. There is a wealth of information and research materials up there. I encourage you just go up there and take a look at it. A lot of interesting information. There's some TED Talks. There are some additional surveys for you to take if you want, as well as another video you can watch. The website address is www.floridatransportationplan, all one word.com. And that wraps it up for me. If you have any questions, thank you.
Do we have any comments or questions?
Mr. Chairman, I do not see any hands. And just to note that Cynthia placed the website in the chat box for those who want to make note of it.
All right, perfect. So now we go general information and upcoming meetings. There are several general information at tab 5. I ask that you read through them at your leisure if you haven't already done so. Also, please note the upcoming meetings of interest. We will now go to member comments. Are there any final member comments?
Mr. Chairman, I do not see any hands, but we'll give a second. Pause just for a second here to see if anyone has any additional comments. And there are none.
All right. So we'll go now to our next meeting. Okay, wait a minute. Are there any written comments?
Mr. Chairman, we have not received any written public comments.
All right. So now we'll go to the final one, which is our next meeting.
Mr. Chairman, I'm sorry. We need to allow opportunity for members of the public who may be present who
that's right.
wish to.
Sorry about that. We're going on to public comments. Any public comments?
And again, I don't see any hands at this point, Mr. Chairman.
All right. Well, I think we had a great meeting for being the first time that we do this. Now we'll talk about our next meeting, which is Thursday, August the 13th. If there's nothing else for the good of the order, I want to thank everyone for attending this meeting. I want to thank especially the staff of MetroPlan for setting this up for us and being patient with us. And if there's nothing else, this meeting is
Mr. Chairman, before you
Yeah.
adjourn, we do have one hand from Commissioner Uribe. Oh, I'm sorry, she just put it down.
Commissioner Erie?
I'm good. I'm good. I just wanted to echo what an amazing meeting and thank you for everybody. It was fantastic. But of course, MetroPlan team is. So
Always.
nothing but the best.
Yes.
And I'm glad they're in the background and they're able to hear that. So thank you.
Yeah, please stay safe out there. Remember not to drop your guard down. We're still in the middle of this pandemic. And even though we're going through a soft opening with phase 1, please don't drop your guard down. We need to protect ourselves to make sure that we can get out of this all alive and continue our lives in what a new normal will probably be. It probably won't be the same normal, but it'll be a new normal. So if there's nothing else for the good of the order, this meeting is now adjourned. Thank you so much. You guys be blessed. Take care.
Thank you, Mr.
Thank you.
Chairman.
Bye,
Thank you,
everybody.
members.
Take care. Bye-bye.